Good morning, it's Dr. Toker, your friendly neighborhood colorectal surgeon, and I am asked frequently about the concept of leaky gut. What is it? And sometimes the easiest way to understand what is it is by explaining a very simple analogy. Go into a bathroom, preferably on the upper floor of your home, and you might see tiles that are grouted together in a little grid pattern and nice and even. And that part of your floor in your bathroom is waterproof until something bad happens, like trauma or a little piece of grout gets taken out. Now, if water gets on the tile, it goes through the hole in the grout and it can get to the baseboard wood. And over a prolonged period of time, if you don't fix that little hole in the grout, you'll get rot in that baseboard wood. The tiles will all start sort of getting loose and you'll get more and more cracks around it until such a time the floor begins to buckle and now you got to replace the whole thing. This scenario is occurring in your intestines at all times. There are cells that are wedged in close proximity to each other with tight junctions, grout for lack of better words. And there's constantly little breaks. Those cells are dying and being replaced constantly. These little breaks get sealed up. It breaks, it gets sealed up. If it ever breaks and doesn't get sealed up, all of a sudden, contents of the intestines can leak through that little layer into what's called the basement layer, where you have blood vessels and lymphatics, and those toxins get shifted away to the rest of your body, where they don't belong, number one. Number two, causes chronic inflammation of the intestinal tract. Your body's response to that inflammation is surrounding the area with what's called protective fat, mesenteric protective fat. Protective fat, the way it's designed is to not dissolve when you're trying to lose weight. And if you've ever known anybody who's had a gastric bypass or they've been on Ozempic, they'll lose weight in their face, their arms, their legs, but they won't lose it in their bellies because your body thinks of it as a protective area. So in my weight loss clinic, I tell all of those patients, you are never, ever, ever, ever going to have satisfactory body recomposition to sort of normal body habitus until you understand that you have to have a lack of inflammation in your intestines. You've got to fight that. You've got to improve your body's ability to restore itself if you get a localized inflammatory response. Okay, so leaky gut just means the cells have separated, contents of the intestines have gotten into a sterile compartment, and your body has created an inflammatory response to it that can cause all kinds of metabolic chaos in your body, and not to mention the symptoms. Any symptom you might have, whether it's arthritis, heart disease, liver disease, obesity, anxiety, depression. Some people think ADD and other mental disorders all start with an inflammatory process of the intestines, and that starts with leaky gut. All right, so that's the explanation. See you next time.